Dr. Gary Bellman, testosterone and fertility. I still get a lot of questions about testosterone and the impact on fertility, so here is a nice overview of how this works. Does testosterone lower a man's fertility? A resounding absolutely yes, it does. Testosterone replacement slows down the body's production because of the negative feedback, and so most men who take testosterone over time will become infertile. Is it recoverable? Well, that depends. Depends on the age of the patient, how long they've been taking testosterone. So do I have patients who've been taking testosterone for 10 years, testicles get a little smaller, they never take any medicines, and it's very hard to recover their fertility? Yes. So this is a guide of how to treat men. Put them in 3 different groups. Sometimes we see men who are newly married or want to conceive in the next year or 2 or 3 and have low testosterone. Those men I don't give any testosterone to. If they want to be fertile in the next year, 2 or 3, I give them Clomid or enclomiphene or HCG or a combination of that. And that generally will raise the testosterone sufficiently and not impact the fertility, and in fact enhance the fertility. Option 2 is men who have low testosterone, but they don't have children, but nothing in the foreseeable future. So those men will talk about testosterone replacement. Sometimes we'll talk about adding HCG, but it's important in those men to periodically check in and say, hey, let's do a semen test maybe once a year or every other year, or if you meet somebody or start thinking about fertility, then we might want to add some Clomid or HCG or enclomiphene or do a semen analysis. And then lastly, there's these men who have had a vasectomy or have had kids and we don't worry about fertility. So the most important thing and the first question to ask a man before starting them on therapy is, what are your plans for children? Again, if they're going to have kids within a year or 2, don't give them testosterone. Younger men who haven't had kids, we can give testosterone, and certainly men who don't worry about fertility. So I hope that explains things and put things into balance.